Hi everyone, I'm Dr. Krisha. Welcome to webinar 12 of the Summer of Health series, where we're talking all about the foundations of health. And right now we're wrapping up the energy section. So we're going to talk about thyroid hormones and sex hormones. And then of course we'll do a Q&A at the end. So super exciting. Let's get to it. So Energy 102. So let's go back to the overview. So in the first, so the important players, right, the red blood cells, mitochondria, and adrenals, that's what I talked about in the last webinar, Energy 101, and how they're so important. And they will keep coming back into play even when we talk about thyroid and sex hormones. So that's why I wanted to bring it up one more time. All right, so this again, right, with the red blood cells, so important because they're what's delivering oxygen to your mitochondria, which are the powerhouses of your cells. That's actually what creates your energy, and so we want to make sure that they are, they got enough fuel. And then adrenal glands, because they are so incredibly important with that stress response and also for your energy, because cortisol, which is that stress hormone, is actually what wakes you up in the morning. So if you don't have enough cortisol, if your adrenals aren't pumping out that cortisol, or if that cortisol is all out of whack, which definitely happens over time with chronic stress, which AKA pandemic, 6 months into it, right? It can then wreak havoc on other systems. And we're gonna talk about that with the thyroid and the sex hormones, but also how, your thyroid plays such an important role in your metabolism, and same as the sex hormones. So let's get into that. So here's your thyroid. So your thyroid gland, so it's right here, so right about like that Adam's apple. It's more prominent in men than women, the Adam's apple, but we still have the same thing. It's this hyoid bone right there. And if you've ever gotten your thyroid checked, right, it's about right here, we push, we feel, and what we're feeling for is if there's nodules, if it's enlarged, things like that. And then at the end, right, we always ask you to swallow. And so what that does is you're actually feeling this pyramidal lobe, which runs right down the center here. So we're just feeling for that. And there's certain things that we can feel and other things that we can't necessarily, depending on your neck anatomy and all of that. But the thyroid gland is actually in the shape of a butterfly, right? Because it goes right like this, and it sits right above the lungs. And so Chinese medicine, that's actually really important. And also the fact that the thyroid gland is right where our voice box is, right? So our vocal cords being there, if you go into the energetics of the thyroid gland, it's the ability to speak your truth, to speak your voice, and as well as a way for you to take in the world and breathe that life in and out. So thyroid gland, incredibly important for life, especially because of its essential functions. So the thyroid gland, it's a major player in regulating the mitochondria, because what it does is actually upregulate it, regulates it or downregulates it, depending on the levels of the thyroid hormone, which we will get into. And then therefore your metabolism. So what it does, it also drives production of many neurotransmitters, particularly serotonin, dopamine, and GABA. So if you don't have enough thyroid hormone, then you can have those neurotransmitter imbalances as well, which then means you can have fatigue, you can have more irritability, you can have depression, anxiety, right? Because it's playing around with those neurotransmitter levels. So the thyroid functions, it regulates your breathing, it regulates your heart rate, because, right, that plays into your metabolism. It regulates your body temperature, because your byproduct of your metabolism is increasing your body temperature. It also regulates your body weight, right? Because that's a function of your metabolism. For women, menstrual cycles as well, because it does play a role in your sex hormones, which we'll talk a little about later. And then also muscle strength. So let's get straight into the thyroid hormones. So the main hormone, the top 3 hormones listed there are the ones that I will actually do labs on. And that's what I use as markers to find out how is someone's thyroid function. And the TSH is thyroid stimulating hormone. So we have our gland, particularly it's the hypothalamus and pituitary. So the TSH is basically a signal from your brain to your thyroid, and it's telling your thyroid gland to make more hormones. So the higher the TSH levels are, the louder your brain is yelling at your thyroid to do work. The lower that TSH level is, the less that it has to yell. And it might even be whispering for your thyroid to do work. That would be an issue with hyperthyroidism, which I'm going to go into in a little bit. So we have different hormones. We have T4, T3, but let's back up all the way down to actually the next one, which is T1 and T2. So those ones are all thyroid hormones, but those are actually inactive. So it's 1 iodine, 2 iodine, and T3 has 3 iodines. T4 is listed first actually because T4 has 4 iodines attached to it. It's actually the back stores of the thyroid hormone, so it actually will stay, most of the thyroid actually makes T4, and less of the T3, which is actually that active hormone. So the T4 basically sits around, your body's ready for it, it's primed, ready to go to stimulate the thyroid, but it doesn't want to quite stimulate the thyroid yet, right? Because if we just make T3, it's active, it's going automatically. It's as if you're lighting that fuel almost immediately. Whereas the T4 is actually, right, stockpiling the fuel so that you can use it when you actually need it. So that's T4, that's 4 again because it has 4 iodines. You pop off 1 iodine, now you get T3, and that's actually what will then bind to the thyroid receptors and create that primary action, which is to increase your metabolic rate and therefore your body temperature. And so the T3, though, also can get changed into reverse T3, which is actually, it looks like T3, right? And it binds to the receptors, but it don't do jack. So it's kind of like that lazy worker. So essentially what it does is it kind of pumps the brakes on that thyroid. So it hogs up the receptors, but doesn't actually do anything to stimulate it. And that comes into play when we're talking about someone's energy levels, because you might have higher reverse T3 levels, which essentially acts in your body as if you have hypo or low thyroid function. So what does low thyroid function even freaking look like? Well, that's hypothyroidism. So symptoms would include that fatigue, the low energy, right? Because you just aren't getting that metabolism, you're not powering your mitochondria, you're not supplying them with the kickstart. And so, right, you're gonna have lower energy. And then thyroid actually does a lot of other things. So by having low functioning thyroid hormone, you then can have constipation because everything is just going to be a little more sluggish. You're also going to have cold intolerance, right? Because guess what? You're not supplying those mitochondria, you're not increasing the metabolism, so you're not generating that body heat, and you're going to get cold, right? So you're easily going to get chilled. You have dry skin because the thyroid gland is partly, or that thyroid hormone is responsible for partially anyways for the skin. Hair loss, right, because it also supplies that as well. You're gonna get weight gain, that's again because of the metabolism aspect. Infertility, because thyroid hormone plays such a big role within your sex hormones as well. And if your metabolism's all out of whack, your body knows, oh, let's not make a baby right now. It ain't the time, for one reason or another. Your thyroid hormone also plays a large role in your memory. So if that's lower, you can have memory issues and poor concentration, right? Partially because it does have an effect on those neurotransmitters, and now we're playing around with those. If you don't have enough of that thyroid, they're not getting activated, converted. So then there's also hyperthyroidism. So that's the complete opposite. We don't actually see this as much in clinic as we do hypothyroidism. And hypothyroidism in particular is much more common in women, particularly older women, just because we start losing that functioning, or there's also more time to generate autoimmune diseases. And so that's part of it. The most common form of hypothyroidism is actually Hashimoto's, where you're just not able to generate that thyroid hormone. And so simple treatment is just taking the thyroid hormone. So basically as if it's a supplement, but it's a prescription. Okay, back to hyperthyroidism. So hypothyroidism is high functioning. So now you have too much. Your system then is getting flooded with thyroid hormone, which then increases the metabolism, burning through all of that energy, as well as increasing your body temperature significantly. So symptoms of that is going to be palpitations, because your body is just, it's as if you had too much caffeine, right? You're like buzzing, because it also plays a role with your heart rate. So it's going to increase your heart rate. You're going to get more anxious. Again, you're going to have heat intolerance because your body already is running at a warmer temperature. So being outside, you're going to be like, too hot. Which right now it basically is anyways, because it's summer. You can have weight loss, right? Because your metabolism is just going, never getting a break. So it's just on hyperdrive. So then you're burning more than you're intaking. You can have increased appetite, particularly because of that, right? You've stimulated all of you just pulled from your energy stores, hence the weight loss. And so now you're gonna have higher appetite in order to meet those demands. And then you can have diarrhea because it, right, the thyroid also plays a role in that ability for your digestive tract to move. It's actually different than the sympathetic nervous system, which puts a halt on your digestive tract. This is different, where it just kind of stimulates that motility or slows down that motility. And so with hyperthyroidism, right, you're getting it overstimulated, which then means you're going to have diarrhea. So that's one aspect that when I do like to look at the thyroid hormones as well. Personally, I actually like to do annual labs on my patients just to get a good base of what is going on inside. And that does include the thyroid hormones, or a thyroid panel, which would include a TSH, right? Again, that thyroid stimulating hormone, because that tells me whether or not you're getting that signal into your thyroid. Free T3 and free T4, because those are the actual hormones that I care about, that are creating that good action of the metabolism. And then it gives me a good idea of what's going on. Is it too much? Is it too little? Is it a conversion issue? All those things we can kind of tease out. All right, so if you've got figured out you have thyroid imbalance, frank pathology, then it's just a matter of doing the treatment for that. So for hypothyroidism, that means supplementation with thyroid hormone, whether that's T3, T4, or a combination. I have found success with both the regular pharmaceutical as well as compounded are both effective. I find that individuals are unique. So some people do a lot better with compounded and other folks don't do so well with compounded. It's just a matter of trial and error with that, and retesting labs to make sure that you're getting the appropriate response with that and the appropriate levels. Hyperthyroidism, a little bit trickier because, right, we're trying to block that action of the thyroid hormone, and so that means another pharmaceutical, which is a little bit harder on the body than just taking thyroid hormone. And again, there's other treatments for that depending on what the actual cause of the hyperthyroidism is. But let's talk about the function of the factors that actually influence thyroid function. So first, we're looking at the thyroid gland, and then you have, right, from T4, we have to T3, which is the normal conversion. That's what we want to get in order to increase our energy. And then we also have that T4 to the reverse T3. And remember that reverse T3 is like the brakes, right? It's going to stop or slow down the thyroid function, which then can mean lower energy. So first I want to talk about the factors that contribute to proper production of thyroid hormones. So iron actually plays a huge role in part with your thyroid. And so this is partly, this is one of the reasons that I actually like to look at ferritin levels when considering thyroid function, because it plays a role. If you don't have enough iron, then you're not going to get that proper conversion. It's actually going to inhibit the conversion even if you have enough of everything else. So then we want to make sure you have proper iron levels. And again, I talked a little bit about that in the last webinar. Specifically when it comes to testing, I like a full panel. So that's looking at your iron levels, the serum iron levels, your TIBC, which is your total iron binding capacity, your percent saturation, and then the ferritin. The ferritin next stores that total iron binding capacity is like the buses. It's what's shuttling the ferritin into the total iron so that your body can actually use it for other means, like make red blood cells and all the other stuff. So making sure that there's not anemia is important for your mitochondria, but also for your thyroid hormones and your energy overall. Iodine, right? Because we talked about how we have T3 and T4, and those four, and that 3 and 4 mean iodine. So if you don't have iodine, then you're not going to have the thyroid function. It's not very common to have iodine deficiency here in the States, but it is more so common in third world countries. We're All right, let's get going. Okay, so factors that contribute to proper thyroid functions, right? The iron, the iodine, and iodine, again, not very common with iodine deficiency here in the States, but more so in third world countries. And we'll talk about some of those iodine sources later on. And then tyrosine. So way back in the mind section, I talked about tyrosine as a precursor to neurotransmitters, and particularly the norepinephrine, aka adrenaline, noradrenaline. And so incredibly important for your neurotransmitters, but guess what? It's also important for your thyroid. It's actually one of the things that that are part of the actual thyroid follicles. And so really helpful there. And we're going to talk about some sources of tyrosine as well. And then zinc. Zinc is so important for so many different things, so many cell functions require zinc, and I'm going to talk about some food sources of that as well. And selenium, also very important for your thyroid. One of the greatest things that you can do in order to get good stores of selenium is 1 Brazil nut a day. Actually gives you the amount that you need, the recommended amount, RDA, the recommended daily allowance of selenium. Then we have vitamin E, all the B vitamins, vitamin C, vitamin D, all that plays a role in getting just proper production of your thyroid hormone. So that's step one. Make sure you get the nutrients, right? And now what happens when we have, we want to push through from T4 to T3? If there's stress, it's going to inhibit it. It's going to prevent actually the breakdown of that conversion. And instead, it's actually going to increase your conversion from T4 to reverse T3. So it's actually doing the exact opposite. So it's not only stopping the stress, right? It's not only stopping your conversion into T3, but it's actually promoting your reverse T3, which means you're actually getting less and less thyroid function with chronic stress. So incredibly important to manage stress. So stress management, whether again, I'm a huge fan of deep belly breathing. I don't know how many times I've mentioned it, but probably almost in every single webinar, because it's just that important and that useful for your overall health. Other things that play a role in stopping the production is infections, trauma, radiation, medications. That's all going to directly inhibit that conversion. Fluoride is actually a inhibitor. In particular, we're talking about like fluoride in the water can prevent the breakdown of the conversion of T4 to T3 because of the direct antagonists to iodine. They compete for each other. Toxins, also, especially pesticides, mercury, cadmium, and lead, all play a role in preventing that conversion as well. Even autoimmune diseases, because they're creating inflammation and havoc on the system itself and creating other imbalances. And then here we have, right, the increasing that conversion of T4 to T3 is the selenium and the zinc, which again, important for just the general production of T3 and T4. And then, you know, with the T4 to T3, stress again plays a huge role because it's going to increase that trauma. Low calorie diet, because if you're not getting enough calories, we want to pump that brake, right? We want to slow down your metabolism. So during starvation, fasting, that you'll get more reverse T3. And then inflammation, toxins, liver, kidney dysfunction, certain medications, all that can influence that. And then factors that improve cellular sensitivity to thyroid hormones, vitamin A, exercise, zinc. As you can see, zinc is really, really freaking important, right? Because it's important for the production of the thyroid hormones, for that conversion, and then also makes the cells more sensitive. All good things. Okay. Next on the slide here is thyroid and stress. So we talked a little bit about it, but your thyroid, when you have excess cortisol in your system, so this is when you have all that stress, right? There's so much cortisol because your body is so overwhelmed with stress, it's pumping out the cortisol like nobody's business. And so what that does then is actually going to inhibit the production of TSH. So you're not going to make the thyroid stimulating hormone in that brain, and then it's not even going to give any signal to your thyroid to make any thyroid hormone. So that's where, right, your TSH is really important to get those tested, because then it tells me, right, if it's low or if it's high, it gives me some indication of what's going on. It also inhibits the conversion of T4 to T3. It also increases the conversion of T4 to reverse T3. So when you put all those three together, it basically means you're getting lower and lower and lower thyroid function. Because you're trying to limit the amount of your fuel that you're using for your general cells, and instead focusing everything on the systems that matter the most, right? The sympathetic nervous system is driving everything to your muscles, and away from the organs that don't matter as much. All right, let's talk about nutrients. So thyroid nutrients. Here we got iodine. I actually don't. Okay, yeah. So iodine nutrient, incredibly important. So some food sources, and you'll see that actually a lot of these food sources will repeat, meaning that they have the food sources such as seaweed actually have multiple nutrients that are beneficial for your thyroid. So in this case, so we're talking about iodine. So iodine is rich in seafood, fish, shellfish, kelp, dairy products, milk and cheese, and eggs, and of course an iodized salt, where we actually put iodine in our salt. Is displaced by bromine. So what that means is it actually gets inhibited or less absorbed when there's bromine in your diet, which actually is commonly found in baked goods and plastics and soft drinks and pesticides, which unfortunately pesticides are a frequent contamination in our food sources, which is why it's important to know about certain things like the Clean 15, what foods can you actually get that don't have as much pesticide, or that you can get conventional grown that don't typically have that pesticide contamination, and the dirty dozen, which are the conventional foods that are heavily contaminated, and therefore you want to go organic. And that's all available on the EWG website, ewg.org, Dirty Dozen Clean 15. I talked a little bit about that way early on in the nutrition section. And then fluoride. So fluoride in your water, in your toothpaste, great for your teeth. But if you're getting large amounts of that, not so great for your thyroid. All right, zinc. I love zinc. Zinc is so incredibly important for multiple reasons. It's good for your thyroid, for it's in all of your cells, so you need it. It's also really helpful in these viral times because it is very beneficial for your immune system. So there's more and more studies coming out, but what zinc does is and this is for viruses in general, not specific to coronavirus, but viruses in general. What zinc does is it gets into the cells, and once it's into the cells, it actually decreases or inhibits the ability of the virus to replicate, which means that you're not going to get as much of that virus DNA, the virus replication, so you're not going to have as much of a viral load in your system thanks to zinc. That's if you have zinc and you have it in your system, in your cells in particular. So great thing to make sure that you're getting plenty of. And how can you get your zinc? Well, some food sources: seafood, fish, shellfish, kelp, whole grains, wheat germ, dairy products, legumes, peanuts, egg yolk, nuts, seeds, all great sources of zinc. And then with zinc supplementation, it's different. So zinc has a positive charge, which means it's hard for it to actually get into the cells. So this is, if you've heard about what's going on with with coronavirus, one of the treatment options very early on, and there's still a lot of debate about it right now, is zinc with hydrochloroquine or hydroxychloroquine or HCQ, along with azithromycin or a Z-Pak, which is just an antibiotic that's more so for secondary infections. But the zinc and the hydroxychloroquine, zinc tries to get into the cell, but it needs something what we call an ionophore in order to actually get into the cell. And HCQ actually does that. Well, there's other things that naturally do that as well. Some of them are quercetin, which is a natural antioxidant. And then there's green tea extract actually will do that as well. There's a few other nutrients that actually will also do the exact same thing where they help, they work as a zinc ionophore, help to put zinc into the cell. But honestly, get it from your diet. Get zinc from your diet because you can't overdose on it when it's food. You can have some issues long-term with supplementation, particularly because zinc and copper compete for each other. So by taking zinc continuously, there can be some repercussions with your copper levels. So have a doctor, follow your doctor's recommendations, ask your doctor. Okay. Let's get into selenium. So selenium is used in the conversion from T4 to T3, which is what we want. And one of the great food sources is Brazil nuts. Very, very rich in selenium. You can actually if you just eat one Brazil nut a day, then that's enough selenium. That's the recommended daily allowance. So that's great. If you're not so much in the Brazil nut fan, then you can have finfish, shellfish, which you can see, right? All the other important nutrients for the thyroid all included some fish or shellfish. And so those are great sources if you're wanting to nourish your thyroid gland with food. Beef, turkey, chicken, all great sources of selenium as well. Whole wheat bread, beans, lentils, and you can see that actually quite a few of the foods that are rich in selenium also rich in zinc, which is great because both are used in that conversion from T4 to T3. All right. That's it for the thyroid. Let's get straight into sex hormones. So here we got estrogen. We're going to be talking about estrogen, progesterone. So those are the main female hormones, and then testosterone, which is the main male hormone. With that said, males and females need all of these hormones just in different amounts. So the hormones themselves, we're going to start with the female hormones, and then we'll get into the testosterone and the DHEA. So estrogen is dominant in the first half of the menstrual cycle. Its job is to stimulate the egg to mature, so it's actually ready for ovulation and fertilization. So it's the primer. It's the one that gets everything going. And then during perimenopause, the way we can think of estrogen, so perimenopausal, when you're going through that transition, and actual menopause, your estrogen levels go from high to bloop, nothing, right? That happens with age. All sex hormones naturally decline with age. So estrogen, right, when those levels are low, same as the progesterone, they get lower and menopause, right? It's just that transition of no longer having them in sufficient amounts to actually stimulate that menstrual cycle and all that. So estrogen, when it's low, and we'll get a little bit into it, but one of the things that I really liked thinking about is estrogen kind of puts on your rose-colored goggles. So it makes everything seem a little bit nicer, makes you like a little bit more chill. And estrogen, when you remove that veil, it's literally like removing that veil. And so during the second half of your cycle, when you're more progesterone dominant, you don't have that like those rose-colored goggles on anymore. Same thing that happens with menopause, and so you can get a little bit more irritable, which isn't really irritable. It's just more of like you realize that you just don't have tolerance for people's BS anymore. That's because you're having less estrogen. Estrogen just, I guess, makes folks a little bit more tolerant for extra BS and all that other jazz. Because otherwise, right, if we didn't have the estrogen, we'd be we need to have a baby and all of that. Anyways, okay, back to progesterone. So progesterone is dominant in the second half of the menstrual cycle. It primes the female body for actual fertilization and pregnancy. So it's actually both of them are needed. They're throughout the entire cycle. They're just in different proportions. Progesterone is that pregnancy hormone. And then when a female doesn't get pregnant, right, there's no fertilization, then the progesterone levels go all the way down. And so we have a play between the estrogen and the progesterone, along with a few other hormones that actually will stimulate the estrogen and the progesterone production, but I don't want to talk about those in particular right now. And then we have testosterone. So testosterone is the male dominant hormone. Males actually make 10 times more than females, but it's still incredibly important for females. And we're going to talk more about that. And then DHEA is the precursor hormone. It's actually the precursor to testosterone and estrogen. And so that's incredibly important to see where your levels are. It also plays a role in, it's greatly affected by stress. I mean, all of them are, right? Because if you're stressed, the sympathetic nervous system's on, your body does not want to put any focus in on your reproductive system. So those all get dampened down anyways. All right, let's talk in specifically about estrogen, get more in depth on that. So estrogen increases your cortisol and your testosterone levels. So that's great because that actually will increase your energy. And in cortisol levels, so one, I want to step back and just mention that cortisol levels the cortisol hormone, even though we call it the stress hormone, it's crucial for life. So it's not like I don't want to demonize it so much where it's like, oh, if cortisol, it's all about that fine balance. And so estrogen, right, if you're in balance with your cortisol levels, then you'll have that higher energy. But if you're imbalanced, then you can have the higher stress, the higher anxiety, all of that dysregulation. Okay, and so if you have high estrogen levels or estrogen dominance, which is actually really, really common nowadays, you're going to get symptoms. You'll see symptoms such as anxiety, menstrual abnormalities, weight gain, bloating, insomnia, because they play a role in that. Low estrogen is going to be menopausal symptoms, right? Because estrogen is just the main hormone that you will feel the most effects from, because it tends to be higher. Anyway, so you'll get menopausal-like symptoms like insomnia, hot flashes, brain fog, fatigue. And then there's hidden estrogen sources or xenoestrogens. These are hidden in personal care products. They're in unfiltered water. It can be in plastics, BPA, all screw up with the endocrine system, which is your hormones. And so that's really important to figure that out if you're getting those hidden sources. And that's actually why so many women tend to be estrogen dominant. You also have males who will actually also tend to be estrogen dominant, and what their biggest symptom that you'll see is that they'll actually have a central obesity or that abdominal weight gain, and that's because that's what estrogen does. It promotes weight gain, but in particular in the abdomen compared to elsewhere, and that's all about the balance between the hormones again. So if you're having high estrogen symptoms, then the treatment then is to get rid of your extra sources like those, estrogens, those hidden sources, as well as trying to get rid of more. And one great way to do that, fiber. Because fiber binds up all the excess, right? So if your gut is sluggish, if you are not having that regular bowel movements, then your body is then able to resorb more and more of that estrogen and that cholesterol. And we're going to talk a little bit about why cholesterol is important in this. But the estrogen in particular, if you're having a lot of constipation, your body's basically absorbing up all of that estrogen, which then means it's getting recirculated rather than going out the tub, which is what it's supposed to be doing, which then means, right, you're going to have more and more than what your body actually wants. And then with the low estrogen, if that's the case, then it's a matter of having to add in hormonal therapy, which is helpful for, and there's also herbs that also are really helpful. One of my favorite herbs for the menopausal symptoms or that low estrogen is maca. Maca is a Peruvian root, so grown in the Andes. It is actually an aphrodisiac, so it's really helpful for low libido, which you can see it also actually is a symptom of low estrogen. It's not written on there, but it is. And really helps to, because it's, so maca is an aphrodisiac. It helps to balance out your hormones, and particularly the estrogen, but it also is a adrenals adaptogen. So what that means is it's really nourishing to the adrenal gland, which also is incredibly important because that can increase your energy levels, but it also is important for your sex hormones because of DHEA. Which we're going to talk about real soon. So hold that thought. All right, progesterone. So progesterone is, right, that second half of the cycle for women. It triggers ovulation. You get that big spike in that second half of the cycle. And then if you then get pregnant, a female gets pregnant, then that progesterone levels stay elevated. But when they don't, when they drop off, that's actually what stimulates the menstrual bleeding. And so progesterone helps to calm you down, make it a little bit sleepy, because, right, it's all about like growing. It's like this time of like, okay, we're going to grow a baby now. So it's going to promote sleep, and that's partially because it via increasing GABA production. So if you remember, GABA is the main inhibitory neurotransmitter. So it's the one that just calms everything down. My personal favorite example of that is like when you think of the movie Up, and it's Doug. Doug does not have enough GABA. So Doug has squirrel brain, right, where he's like, well, like squirrel, easily distracted. There's no filter, right? There's no, like, the blinders, they ain't up. And so GABA helps to put that up. It helps to shut down or quiet down the rest of the noise in the brain so you can pay attention to one particular thing. Or you turn everything down so you can sleep. Progesterone levels are the highest in week 3 of your menstrual cycle. So women out there, if you notice that you are more tired on that second half of your cycle, it's because of progesterone. So low progesterone symptoms, ironically, right, can cause fatigue. Part of that is because it causes insomnia, right, because it helps with the sleep. And if you're not getting good sleep, you're going to have lower energy. You can have infertility, and that's true with imbalances in any of the sex hormones, not just estrogen or progesterone. And then, of course, low libido. Okay. Testosterone. So testosterone is the male hormone, and it actually gets converted from estrogen via the aromatase enzyme. And then testosterone, what it does is it stimulates red blood cell production, and that increases energy, right? Because if you have more red blood cells, you have more oxygen. If you have more oxygen that's being delivered to your cells, you then are powering your mitochondria with more resources in order to create more energy, and that's what it's going to do. So that's great. It also has immune modulating properties. It reduces cholesterol, really helpful for multiple systems. It also helps with your gaining muscle, right? Muscle mass. That's why males generally have a more muscular physique than females, because they have that extra testosterone. And then you have the low testosterone symptoms. It can be fatigue, right? Because you're not having energy. So it can be similar, like iron deficiency anemia, where you're just tired all the time because you don't have that oxygen or the red blood cells. You're not generating enough of them. You can have low libido, right? Of course, because if you don't have the sex hormones, they're the ones that are dictating whether or not that system's getting used, and it's saying, no, pass. And then muscle weakness, because the testosterone, right, helps with gaining the muscle mass. And so if you don't have enough of that testosterone, you're not stimulating that muscle creation, which unfortunately also means you're not making more muscles and therefore not more mitochondria. So it's like a double-edged sword, right? Because you're decreasing, it's like the negative. Okay. So what then happens with testosterone? How can you support that? There's multiple ways of supporting both your progesterone. Progesterone, you can do precursors to progesterone as supplementation. You can just do straight up progesterone supplementation. All that that does require a doctor's prescription, and something that then you would do through labs, so that you can do sex hormone testing. For females, it needs to be on particular days of your cycle if you're menstruating, because that's when we want the optimal levels, or the standardized levels, so that we know we're comparing apples to apples, right? Because if you do estrogen during the second half of the cycle when it's not the highest, it might come up as falsely low. And same thing with progesterone. So those need to be done during certain days of your cycle, and it's all just a simple blood test. Insurance covers it. Testosterone, simple blood test. That does not need to be at a particular time. It doesn't need to be fasting, none of that stuff. So super easy to do. And let's talk, so DHEA is a great one to add on to the test. It's actually one of the hormones that I test when I'm looking at the full panel of sex hormones, because it's included, because again, it's a precursor to estrogen and to testosterone. It's actually predominantly made in the adrenal gland. So this is where stress comes in, because if you have so much chronic stress that your adrenal glands are tapped out, right, you have essentially like adrenal dysfunction, or they're just depleted because they've been pumping out as much cortisol, DHEA, like all of the things, and so they're essentially empty. Then you're going to have low DHEA levels, which then means you're not going to have the precursor to estrogen. So you're not going to make the estrogen, and then you're not going to make the testosterone, because again, right, estrogen goes into testosterone via the aromatase enzyme, which is actually one way that we can increase testosterone levels in males, is via aromatase inhibitor to stop with that. Anyways. And let's see, supplementation. So one way that we can then take care of low DHEA levels, and this of course needs to be done with testing to see exactly where your levels are. And again, those levels change through age, and so the reference ranges are different for someone who's younger, and if again via female versus male, it's different because of that testosterone need. So males are going to need more DHEA than females because of they need to make more testosterone, so they need more of that hormone. Okay, and next we have, so we definitely want to recommend testing the levels beforehand, and then also sometime throughout the supplementation to monitor, to make sure that you're not getting too much of the DHEA, because then that can push too much, and then now you can have symptoms of too much. And so it's always a fine balance when we're talking about hormones in particular. And then there is this misconception that DHEA, because it's produced in the adrenal glands, that supplementation can also increase cortisol levels, but it doesn't. It's not going to do that. That's it's a lie. All right. So DHEA can be really helpful for supporting your sex hormones because it's a precursor hormone. There's other precursor hormones, pregnenolone, which is the biggest one for the estrogen progesterone. And those, I just use the estrogen and the progesterone testing for that to see what the levels are, and then go based off of that actual thing. And then usually we're actually prescribed, I typically will just prescribe the hormones or use herbs that help to promote that balance back. All right, so we're talking about cholesterol, because guess what? Cholesterol is so freaking important for your hormones, for your overall body. I haven't gotten to say this, but cholesterol is literally every cell membrane in your body is derived from cholesterol, so it's incredibly important. So I feel like in our society, we talk a lot about you don't want high cholesterol, which is true, you don't, but you also don't want low cholesterol, because low cholesterol means that you can have that imbalance and you can have several symptoms. But cholesterol is the precursor to your sex hormones. So if you don't have cholesterol, you ain't gonna make sex hormones. The way I do, and I definitely recommend testing your cholesterol levels. It is part of that annual blood screening that's done. It's typically a fasting 10 to 12 hours lipid panel, and that's really partially because for me anyways, I also like to see a fasting glucose, which is another part of the another test that I do. So that's really helpful. And then it also changes your triglyceride levels depending on what you ate. So fasting can give us a better of a baseline. Though we can do it, so if you've done lipid panels without fasting, that's also okay, it's just different reference ranges. So the benefit of, again, the testing is just to address those imbalances, and that's the first thing that I want to do is look at those. And so when I have folks, particularly if they're having issues with memory and focus, cholesterol is definitely something that I want to look into, and addressing that if there's an imbalance, addressing it. Because again, we also want sufficient cholesterol, so we want enough of that cholesterol, but we also want it to be balanced. So we have two other aspects. We have the total cholesterol, and then we have HDL, which is the high density lipoprotein, and the LDL, which is the low density lipoprotein. And those are the two main ones that I look at, the HDL and the LDL. The HDL is what we call that good cholesterol. It's the one that actually goes from the periphery, so in your arteries, and it takes up all that excess cholesterol and it puts it back into the liver for the liver to do good work with it. The LDL is what we call the bad cholesterol. It does the exact opposite, right? It will take from the liver and then use it to patch up any inflammation and issues within the arteries, etc. That's a generation of atherosclerosis. So we want to have a good amount of cholesterol to balance, so you have enough of your sex hormones as well as your cell membranes in your brain, but you also want to have enough HDL in order to make sure that it's still protective, right? Because if you have too much cholesterol throughout your entire body, then you're going to be more prone to having cardiovascular issues, and I don't like that so much in my patients. And so we want to emphasize your HDL, and there's some great ways to increase that. And honestly, a lot of it we've already talked about. It's diet and exercise are one of the best ways to do that. So other ways of balancing out your cholesterol levels, because again, it must be balanced. And then if you're, so some great sources of healthy fats, because it's going to push you more towards having HDL rather than LDL. The healthy fats are also more anti-inflammatory. We talked about that in one of the nutrition webinars, specifically the omega-3s versus omega-6 and 9s. And so your healthy fats are going to be your wild-caught fish, which is incredibly important. That's wild caught, because if it's not wild caught, then it's going to have different, so if it's farmed in particular, you're going to have different oils. The proportion of omega-3s, 6s are going to be different than in the farmed. Same is true for grass-fed, grass-finished versus conventional grown meat. Now, avocados, great source of healthy fats. Nuts and seeds, also fantastic. So honestly, can't go too wrong with that. So eat plenty of that in your diet. And then fiber. Fiber is so important because it helps bind up your excess cholesterol and your hormones. And it's not going to be to the point where it's like binding up too much. I'm not going to tell you, it's less likely to happen, though I guess there is a possibility. Though your body will naturally also has production of cholesterol and also the hormones. And so you have that innate ability to make it, which is why if you have the healthy fats, you're already supplying it. Whereas the fiber just helps to take up any excess. Which also depends then if you have too much cholesterol. I'll actually often recommend patients to eat a lot of fiber with their fattiest meals to prevent the absorption of that cholesterol. But if you don't have cholesterol issues, then just fiber in general just helps with your hormones and your cholesterol levels, and your digestion and so many other good things. So make sure you're getting plenty of veggies and fiber to make sure that your bowel movements are regular, because that is so incredibly important. Okay, this quote I thought is fantastic because it's a great segue. So pay attention to whom your energy increases and decreases around. That's the universe giving you a hint on who you should stray from or stay around. Anonymous. What I like about that, right, is next week, we're going to be talking all about community. It's going to be our last webinar. So we're coming to a close here. And community is so incredibly important, and a way that we can increase our energy energy or decrease it depending on who we're around. So we'll talk more about that next week. With that, let's get to your week challenge. So your week challenge is just fine tune your nutrition. Eat more healthy fats, get plenty of fiber because those things are going to help your sex hormones. You can increase, right, all the other things too. So like make sure you're getting, your dose of fish in, or seafood in order to get your selenium, to get your iodine, all those nutrients. Because the great thing about getting your nutrients from food is that you can't overdose. Your body's not going to overabsorb from food compared to like if it's from a supplement, which it very well can take too much of. So my preference is always to get things from your diet. So now is the time to fine tune that, and especially because we talked about it way long ago. So if you need to go jump back to nutrition, those first 2 webinars, please do, because they were chock full with so much great information. And your nutrition is truly your foundation for your health, because what you put in your body is your fuel, right? And you want to put high quality fuel in there. So do your best and go back to your full health assessment and see where you're at now and how you can get it better. All right, let's get any questions for me. I'm happy. Question here, is it possible to get the body to a state where you can get off of your thyroid prescription? So it depends on the reason for the thyroid issues. I have had folks, so I have one patient in particular who she's been on thyroid medication on a particular dose for over 10 years. And for those 10 years, like her dose was very consistent. She started working with me in particular for improving her neurotransmitters because she's dealt with chronic depression and anxiety. And so we ran, I ran a Labrix neurotransmitter test as well as a cortisol saliva test with her. And after working together, after we got those results, we saw what she needed to fine tune with. She needed adrenal supplementation, adrenal support because she had less, just like chronic stress over time has taken a toll on her adrenal gland. So I started supporting that with herbs and other nutrients as well as her neurotransmitters. And she came back to me, she reported back to me after maybe 3-4 months of being on all the supplements that her doctor actually decreased her thyroid dose because of all the work that we did. We supported her adrenal gland so that then she was actually able to make more cortisol, which then, right, your cortisol levels, if they're too high or too low, so we fine-tuned them so that they were in balance again, which then meant her thyroid wasn't getting inhibited for that conversion into the T3 to the T4, as well as pushed into, right, the reverse T3. And that's actually what I think likely happened with her. And so I do think there is a possibility to get your body into a state where you either can decrease your dose or get off of it altogether, depending again on the cause. If you had radioactive iodine treatment, that thyroid function is unlikely to recover because that treatment in particular is for hyperthyroidism. So if your thyroid dysfunction is due to that, then it can definitely be much more challenging, if not impossible. So I do think that it's possible, though it again depends on everyone's situation, and that's where taking labs is really beneficial, and then working with a qualified practitioner. Okay, another question, where do you find that full health assessment? So that is going to be in my website. So if you go to drcrystalolson.com/SOH for Summer of Health, it is password protected. The password is capital RX, capital D, docere, which is DOCERE, so capital R at lower lowercase x, capital D-O-C-E-R-E, which stands for prescription docere, which is Latin for teaching. So it's education, prescription education. I thought it was really witty. I enjoyed the password. Anyways, go on there, and in the very beginning in the top section, you'll see a link for the full health assessment, which you can then just click on and download. It's designed so that you can then go keep track of your progress over the 3 months. Okay, other question here. So if you have an 80-year-old male and an 80-year-old female, would all their hormone levels be about the same with his testosterone going down and her estrogen going down? Theoretically, yes, all the hormones would be more similar to each other than a 20-year-old male and female. Their hormones would definitely be a lot similar in the 80, though again, everyone's a little bit different. And at that point, honestly, for 80-year-old male and female, their testosterone and estrogen levels are probably going to be relatively low. The actual production, though that's not to say that you can't have good reproductive health and good energy in your later age. It's just fine-tuning the rest of the systems. Okay, other questions for me or clarifications? Let's see. If not, then I will go ahead and end this one, and we shall pick up next week for our very last webinar all about community. So hope you'll join me and bring a friend. We're going to talk about some great stuff and how to keep this summer of health going into the fall. So thank you very much for joining, and hope you have a wonderful, wonderful rest of your day. With that, goodbye.